Good evening and welcome to another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Authority to give you information about the scheme, news updates, as well as explain issues around the NHIA. Under the new NHIA Act, every Nigerian is expected to be covered by one form of health insurance or the other. In this episode of the program, therefore, we will enlighten you on the various programs under the NHIA, how they function, and how to get enrolled so you too can access health insurance when the need arises. I am Aisha Muhammad Ahmed, your anchor on the program. Sit back and relax as we unfold the program to you. I will be back shortly.
Let me see your bill. What is this in your bill?
Oh, that. It's gift ship fully paid. Are you an enrollee? Are you registered under the Group Individual Family Social Health Insurance Program? Gift ship.
Gift ship. What is gift ship? Tell me about it.
GiftShip is a group individual and family social health insurance program. Now, the health insurance is mandatory for every Nigerian. GiftShip allows artisans, traders, farmers, mechanics, business owners, taxi drivers, even keke riders benefit from a range of medical surgeries, medical tests, scans at any preferred NHIA accredited hospital in Nigeria. To enroll, an individual contributes only 45,000 naira per annum. For a family of 3, 45,000 naira per annum. Group of 10 persons and above, 15,000 naira a person per annum. This amount is renewable every year.
First on the program is a highlight of events around the NHIA. Our top story is the signing of a memorandum of understanding between the Society for Family Health and the NHIA, just as NHIA Savicom holds a review meeting in Kaduna. These and more stories coming your way shortly.
The National Health Insurance Authority on Friday 19th May 2023 signed a Memorandum of Understanding with the Society for Family Health. During the signing of the MOU at the corporate headquarters of the NHIA, the Director General said the MOU will deepen the penetration of health insurance in the nation.
I want to allude to the fact that this is going to be a very good collaboration. I have no doubt in my mind. We have discussed with them when they came, and we have constituted a technical working committee that were to look at the various areas where the collaboration will be anchored. And going through the list of the areas, you will all agree with me, there are areas that are of paramount importance to the National Health Insurance Authority. And there are areas that has to do a lot with deepening the penetration of the National Health Insurance Authority and activities in Nigeria. We are talking about issue that has to do with health insurance under our roof, which is the overarching coordination platform of the health insurance ecosystem in Nigeria.
Responding to this, Dr. Omokudu Idoko, Managing Director, Society for Family Health, appreciated the NHIA and promised to give their full support to the task.
For Society for Family Health, our mission as an organization is very much about how we improve lives for all Nigerians. So that's our mandate, that's our mission, that's what the Nigerian people and our donor entrust us to do. And I think in our reflection, there's no other better vehicle today to actually get that done than NHIA at full steam, actually providing universal health coverage for all Nigerians. And I think that sums why we are here. That sums the importance we've attached to the MOU that we're about to sign. For us, it sits at the very peak of our strategic actions to deliver the mission that we are responsible for.
In the same vein, an American multinational company, IQVIA, has pledged technical statistics support for the NHIA. They made this known when a team from IQVIA paid a courtesy visit to the NHIA. Speaking at the event, Dr. Chijoke Kaduru, who led the team, said the visit was to seal a partnership that will enable IQVIA offer actuarial management and capacity building for the NHIA.
Our goals are really that at the end of this conversation, we would be better in tune with some of the key leadership that drives any use of actuarial studies in the agency, and to work out how best we can support them in their day-to-day work to help the agency actualize its goals under your leadership and in line with your vision.
While responding, the DG NHIA said the partnership was timely, bearing in mind the defined role of the NHIA as regards to the new act.
I will call for quick development of memorandum. One, having a very robust discussion with our people, with our team, technical discussion. After this interface, this engagement, we have to have our team and your team to do a deep dive into the conversation of where are we with respect to, where have we come from with respect to actuarial analysis in Nigeria? Where are we now? And where do we hope to be in future?
The new register, there really is not there. Sometimes
the NHIA Servicom Committee held a review meeting in Kaduna to discuss how to respond to feedback from its customers, enrollees, and to also address change in management policies through its Servicom delivery.
Before they continue to assess care, even after
the gathering brought together Servicom focal persons, representatives from various NHIA departments, zonal and state offices within the North Central Zone. Discussions were geared towards identifying challenges in service delivery, how to set out recommendations, and to proffer solutions through promoting the mandates of the NHIA more effectively and efficiently.
For better and effective
Abdusalam
service
Umar,
delivery.
Deputy Manager, Servicom NHIA, highlighted some of the factors that prompted the meeting.
Enrollee complaints with respect to missing names in NHIA register and fresh registrations not being reflected in registers that followed, hospital issues, which are all part of the issues one would naturally expect when you have millions of enrollees. At the end of this meeting, we hope to put our observations together and our recommendations together and forward to management, and management has always been responsive. This is not the first. We've had series of meetings. Each time we have meetings, we come up with new ideas, new recommendations, and management usually always implements, and this has led to better service delivery in the NHIA.
The Servicom department of the NHIA is also saddled with the responsibility of monitoring and evaluating programs, as well as carrying out cooperative user satisfaction surveys on products, customers, and different packages offered by the NHIA. Participants spoke on the impact of this meeting.
So far, I have heard and I have seen that our problems are like related. Every state has been complaining about the same thing. So initially I thought it was just a Kaduna State issue. But seeing now that it's a general issue, it's going to help us put our heads together. They say 2 heads are better than 1. So we're all going to put our heads together to come up with solutions to better our services to our enrollees.
Others also commented on the take-home from the committee meeting.
as a PR person, we do a lot of sensitization, and in the process, we get to hear complaints from our enrollees, and which I must add, most of them are quite touching. So what I've gained a lot from this meeting. I'll know how to help the enrollees better, how to answer their questions better. I know the channels to refer them to get solutions to their problems.
We've treated the ways forward, and we hope to take this back to management so that it can be implemented into the system for us to have a better service delivery.
The program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Authority. The NHIA was created and designed to provide social health insurance in Nigeria, where healthcare services of contributors are paid from the common pool of funds contributed by the participants of the scheme. Given that health insurance is now mandatory for Nigerians, what are the various programs of the NHIA? Who are the beneficiaries? These are some of the things we shall be finding out in our next segment, Issues Around the NHIA. Stay tuned.
The NHIA was created by the federal government of Nigeria to bring succor and to ensure that every Nigerian has access to good healthcare services. The National Health Insurance Authority, therefore, has developed various programs to cover different segments of the society. These include formal sector, informal sector, and the gift-ship program. The formal sector social health insurance program is a social health security system in which the healthcare of employees in the formal sector is paid for from funds created by pooling the contributions of employees and employers.
One, you have what we call the public sector, especially those with the federal government employment. And we have organized private sector, companies with 10 staff and above that want to enroll their staff within the scheme. That provides a platform for them. We equally have an innovative program we have designed, we call the gift-ship, the group individual and family social health insurance, which we think is what we use to give those Nigerians that are not actually within formal employment to come into the scheme, as our mandate is to see that nobody is left behind. So under the gift-ship, we have in fact, we try to subdivide it to be able to, because of the business rule. The main gift-ship has its own business rule. We have a part of the gift-ship which we use to cover the retirees. Currently, we have the DSS, the retirees are being covered. We have the police, the retirees are being covered. We have another one we call the constituency project, the zonal intervention project, which are being funded by members of the National Assembly as part of their constituency projects and zonal intervention projects. And these are still ongoing and providing access to Nigerians.
Since its launch nearly 2 years ago, gift-ship has fared well in terms of coverage.
The gift-ship program is doing well generally. Most of the states have, in fact, our state coordinators have taken it upon themselves. That is the driving force of a lot of their actions now. Like, but if you look at Kwara State, they are doing very, very well. You look at states, especially in the southwestern states, they are doing, the southeastern states, they are doing very, very well with the gift-ship. Even some of the northern states are equally coming up to pick up the coverage with gift-ship.
For the formal sector program, the employer pays 3.5%, while the employee pays 1.75% of the employee's consolidated salary. For the private sector program and other tiers of government, the employer pays 10%, while the employee pays 5%, representing 15% of the employee's basic salary. However, the employer may decide to pay the entire contribution. Unlike the formal sector, the informal sector caters for persons under the informal sector of the economy. It covers employees of companies employing 10 or less people, artisans, voluntary participants, rural dwellers, and others not covered under the formal sector. These include Basic Healthcare Provision Fund, Tertiary Institution Social Health Insurance Program, and Vulnerable Group Fund. The Basic Healthcare Provision Fund ensures the provision of basic minimum package of health services through the National Health Insurance Scheme. It aims at strengthening the primary healthcare centers. It is implemented through the state's health insurance agencies who are close to the communities.
It's not a program or a project. but it's a funding or financial intervention to the health sector, so that the health sector will have additional extra source of funding. So it's the main vehicle, financial vehicle, to finance that basic minimum package of health services as specified by the National Health Act. What is the overall aim of basic healthcare provision? The overall aim is to significantly drive the nation towards achieving or attaining the universal health coverage in line or in accordance with the National Survey Planning, Health Planning Part 2 in a long time, and the SDG in the short term.
Although the Basic Healthcare Provision Fund is implemented in the states, the Tertiary Institution Social Health Insurance Program is monitored at different levels so that its objective can be achieved by the formal sector.
We monitor the tertiary institution social health insurance, and this is meant to cover students in tertiary institutions that are already above 18 years, because the scope of coverage of our formal sector is the principal, his spouse, 4 biological children below the age of 18. So it is presumed that any child that is above 18 will have graduate from secondary school is now in tertiary institution, so that they will not be left out. So we designed that program to cover them. And apart from that, even before the advent or the new act that made provision for the vulnerable group, we have the Vulnerable Group Social Health Insurance Scheme to cover indigent and very poor.
Vulnerable Group Fund is designed to provide healthcare services to persons who, due to their physical status, including age, cannot engage in any meaningful economic activity.
The Vulnerable Group Fund is a new something that was established under the National Health Insurance Authority Act 2022 that make provision for health insurance coverage for over 83 million vulnerable and indigent. And the sources of funding this vulnerable group, basic healthcare provision is one of them. Then we have special government intervention. Then we have donation and grant from partners, and also voluntary contribution. Then the implementation of the vulnerable group, the NHIA governing body or council will define and determine the criteria. And also in determining and defining who is vulnerable, also they will also define those criteria.
With the various social health insurance programs designed by the NHIA, it is relatable to note that employees of these programs all enjoy the same robust and comprehensive benefit package.
The benefit package for National Health Insurance Scheme, the formal sector program, is actually very broad. Just like you have mentioned, they provide for health needs at the 3 levels of primary, secondary, and tertiary level of care. So at the primary level of care, the patient is entitled, or the enrollee is entitled to the services, the normal average services that most people go to hospital to seek treatment for malaria, antenatal services, treatment for enteric fever, for upper respiratory tract infection, and for all the other uncomplicated illnesses that are treated at that level of care. And if there is a need to refer to secondary level of care, authorization code is sought from the HMO, and then the enrollee can move on to the secondary level of care. At the secondary level of care, we also have a lot of services, which includes surgeries for delivery, like the cesarean section, or surgeries for appendectomy, and many other surgeries, prostatectomy, mastectomy for the breast, and several of the surgeries that we do. In short, the benefit package of NHIS is very comprehensive.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. On today's episode, we shall be talking with Abioye Olayinka, NHIA desk officer in Itunu Hospital. She shares her job description and speaks on some of the challenges faced by healthcare providers.
Well, I do welcome the enrollees, and after welcoming them, I ask for what they want. If it is to receive treatment, then we proceed with that. Either I ask for their NHIS number, ID number, or if it is those that use the portal, I have to cross-check on the portal if they are active on the scheme or not before proceeding on whatever they want to do.
Olayinka speaks on her experience in dealing with both health maintenance organizations as well as enrollees.
It's wonderful. It's wonderful. Most of the HMOs do respond quickly, either for the claims or for referral. They do respond quickly. There is some ups and downs. Like I said, some of the HMOs, whenever I do get across to them, either on phone or email, they do attend. They do respond quickly, but there are some that it takes hours before getting to us, and at times I do normally fight with them that why do you like delaying your enrollees, because these people need quick attendance, but we do resolve it. There have been some enrollees that whenever they come, if you should ask them for their ID number or ID card, they just flare up with you. But I will just have to tell them, I have to know this for me to know maybe you're still on the scheme or not.
Finally, Olayinka has this to say about the NHIA and its reconciliation initiative.
The reconciliation program is good, because with that we've been able to receive some of our payments that the HMOs are still holding on to.
That was Abioye Olayinka sharing her experience as she discharges her duty as the NHIA desk officer in Itunu Hospital.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Do pensioners contribute to NHIA?
The pensioners and the elderly are a very important aspect of our population that we are interested in. NHIS is developing programs to capture the pensioners. Many of them are already enrolled under NHIS, like the pensioners for the military, the Navy, the Army, the Air Force are already on board. The police are currently being enrolled. Some of them are already accessing care. The ones for DSS too are already also being enrolled. They are already enrolled. Some are accessing care. Some are still being enrolled.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Here we draw the curtains on this episode of the program. Join us again, same time, same station for another episode as we continue to bring you more stories of happenings around the NHIA. Please visit any NHIA office to enroll into any of its programs. Enjoy.